artery of the upper limb, that's towards the end of the upper limb, and this is what is known as a common palmar digital artery. So talk about the anatomy of the common palmar digital artery. So you get to see that the common palmar digital artery gives rise to what is known as a proper palmar digital artery. So what about these arteries? So you could see that this is what the common palmar digital artery. So it's the one that actually gives rise to the proper palmar digital artery. So what are they? We said that common palmar digital arteries, they are superficial branches of the what? They are branches of the superficial palmar arch. Okay. So each common palmar digital artery runs between the metacarpal bones towards the fingers, then divides into the proper palmar digital artery. So you can't just discuss the common digital artery without what? Mentioning the proper digital arteries. Okay. So the proper ones are the ones that are now beside, in between your hands. So they run in between your hands, supplying blood in between your hands. Okay. So what next? So the common palmar digital arteries, they arise from the superficial palmar branch. Okay, formed mainly by the ulnar artery with some contribution from the radial artery. Okay. So what next? So cause. The common palmar digital arteries, they run distally in the palm between the metacarpal bones. They travel alongside the corresponding nerves, okay, and they give rise to the proper palmar digital arteries. So each common palmar digital artery will now bifurcate near the metacarpal joints, okay. So this is now what will yield the proper digital arteries. So the resulting proper palmar digital arteries, they run along the medial and the lateral sides of each finger. So branches, the common palmar digital arteries, they divide into the proper palmar digital arteries. So proper palmar digital arteries will now give, various branches in between your hands. So the other ones that supply the skin, the subcutaneous tissues, the joints. So you learn about it because if they are compromised, it could lead to what? Shortage of blood supply towards the fingers. That's finger ischemia. Their surgical relevance, and also what? The variations. Okay, their distributions can be different from one human